off. Okay. He will replace it with a piece of bone from that rib that he's working through. Okay. So it will be, there will be something here for that gap. It's not going to be, I don't think he does it as high as it is now, because as he said, that's not what he wants. He wants to shorten the distance.
Stretch out, you want to
So
shorten
he
it,
wants to not stretch out. So then by shortening that, by not having as much, then he can go from the back and straighten this more. Okay?
Oh, okay.
So where this is wedged now, like the triangle comes, like it's okay here, and then it wedges in here. So you got this collapse. That part he will straighten, but just not as much as like a full vertebral height.
But that's with new material. So how much?
Well, no, then there's no real material that he uses.
The rib stuff.
The rib stuff is what he's replacing with this. Okay? From the back, then, he straightens that. He places these rods and screws where that will keep that at the right height. He will use some ground up bone, and he will kind of put those in the gutters here.
Okay, yeah.
And that is going to really be what fuses together and holds everything stable.
Where in this is the blood vessel that he's talking about?
The blood flow?
Yeah,
The core blood flow?
yeah.
There is no, like, blood flow per se, it doesn't come from big blood vessels here. It probably starts up at your neck and runs down your spinal cord. So through here, blood vessels aren't really an issue. It's not like he's going to rupture one or something. So
It's just
that the spinal cord is getting pushing on
Clamping
it.
them
So
up.
it is.
So it's like you've got the spinal bones, and then a cord that goes down through,
The cord's going down the middle here.
the blood vessels are wrapped or running along that.
No, there's
cord.
not even real
No.
blood vessels. It's just
Oh.
the blood vessels.
Oh, okay.
There's a blood supply, I think, that comes from up here. It's not like it's the
So it's not
cord
going-
being compressed. It's
All
not
right.
individual blood vessels.
Right.
It's because the cord is being
Like the
compressed.
hose
Yeah,
is the cord.
the hose
And you
is
clamp
the
it and the
exact-
blood flow cannot go through that cord
Well,
very
and it's
well.
not. Yeah, it's the cord is an entity, it's a bundle, and
Right.
so you. But yes, the blood flow that starts from the top and is coming down is being cut off also.
Okay.
Okay.
I have a question.
Yes.
I think. So how much material do you think actually gets removed there? Is that this whole big chunk?
He is
of
going to
this
take
stuff?
out. Yes, he's going to take out that whole disc.
And then does these parts
The
get left?
the disc
Or
is
the-
not. I should say the vertebral body.
The vertebral body, is that this
This
round
piece,
area
yeah,
here?
this bone.
It's
He's
like
going to
it-
take out
that's cut
this,
there, maybe?
and then he's going to put in a smaller piece of bone, and then straighten this back up.
Makes
And
sense
the
to me.
rib is that bone that he
That he's going
uses?
to put.
Okay.
Yes, he's going to take a piece of that
Rib.
bone, or that rib, and
Okay.
and put that there, and then it really by stabilizing the back. That's going to keep that in place. Okay, it's going to be cushioned on either side by your vertebral discs. Okay, and because this is stabilized, then that keeps this in place.
And so these parts over here, of course I don't know what they're called.
Mm-hmm.
The part that's connected to this one vertebral body, does that go away too, or does that stay there?
So he's going to cut off some of these pieces. It's called your lamina. It's like the roof over your spinal canal. Okay, it doesn't stabilize anything. It's just, but then if that's gone, scar tissue forms, and that becomes the roof that is then protecting.
So that
your
might be
spinal
gone.
cord. Some of that may be gone. He may use some of that to grind up and put in these gutters here to create that fusion.
But the part that's really in his way is over here, because this thing is bent over that, is that right?
Right. This is wedge shaped this way.
I don't feel like, even with a good tool, I can take that out of there without wrecking all the rest of this.
That's
No,
why
How
he
the
said
heck
it's
he's
a
gonna do
horrible
it
surgery.
inside.
Oh, where's the cyst?
I have no idea.
Okay, that's
This
okay.
is minimal anyway.
Right.
Yeah,
But I
a
just
lot of
want-
people have cysts.
Okay,
Yeah.
all right.
Yeah, I have no idea.
Okay, that's fine.
Okay,
Thank
so
you for
you'll have
explaining
so he puts a screw into each pedicle, and then it's one rod that
Okay.
connects. Okay, so fusion takes place usually. We say a good fusion. We see that by about 4 months. Okay. Once that fusion takes place, that bone has fused together. You don't need those rods anymore. We just don't go in and take them out because it's another major surgery. If in the future, I mean, you are kind of skinny. If you shouldn't feel them. Sometimes really skinny
Right.
girls do.
Yes.
They just press up against them.
A
against,
hardwood chair.
Yeah.
Oh.
And if you do feel them, they could come out. We would wait at least a year. It's nothing like the surgery. It would be nowhere near as extreme as the surgery is. It's just opening up, taking the instrumentation out, maybe an overnight stay in the hospital, and you're good to go. So they can come out in the future. That is not what's holding everything stable.
Okay.
So your hospital stay will probably involve first night in ICU, most likely, because they're going to put this chest tube in. That makes sure your lungs stay inflated because we're kind of manipulating around that on the one side, and just good pain control and stuff that first night. Then you go out to the hospital floor. You'll be in an orthopedic portion of the hospital. We have our own area, so you're not in the main part of the hospital, but the nurses there are all orthopedic nurses. That's all they do. Okay. And, during that time frame, you'll have continuous IV pain medicine going, the ability to push a button for more, and then once you are able to start eating, then we start you on pain pills. The determination for when you can go home, is when your chest tube comes out. Usually that's the next day. And then when you're relying solely on pain pills, and when you can get up and do your normal activities and just need the pain pills, okay? That could be a couple days, that could be 5 days. Your motivation factor is what's gonna get you up and moving, get you, off of the IV pain medicine and onto the pain pills. We typically do a long-acting pain pill, a short-acting pain pill, and maybe some Valium, some muscle relaxers. Because it tends to be muscle spasms, which can cause you the most discomfort. Once you go home, we want you primarily on a good aerobic. Doing a walk each day, whether that's outside, in your house, whatever. You will probably be napping. I mean, it is a big surgery. You'll probably need more rest than you might even expect you to need. But the most important thing is that you're getting out of bed and moving at least 3 times a day, okay? And moving more actually can even help with the pain, improving the pain, okay? Those first few weeks, not a lot of heavy lifting. Like if you were in school, we would tell you to limit your backpack, like 2 books at most in a backpack.
Oh, geez.
Or a rolling backpack, or 2 sets of books or something like that. So that's really your main restriction is limiting bending and twisting and limiting the weight that you're carrying. We will fit you for a brace when you're in the hospital because we want to know what we've adjusted you to, and we'll want you wearing that brace when you're up and active. It's not something you have to sleep in unless it's more comfortable for you, etc. Because really those rods are keeping everything stable. This is just support and kind of a reminder to use good body mechanics.
Gotcha.
All right. I see you at a 3-week appointment. Make sure your incision is healing well and that you're doing okay.
Oh, all right.
And then technically, your next appointment is 4 months post-op, and you see Dr. Sasso. He does x-ray, make sure the instrumentation looks good. And then really at that point, we kind of cut you loose. You won't have any restrictions. We don't want you horseback riding, skydiving, or roller coastering the first year, but
Darn it.
I know.
Those things at once.
But, really, your restrictions are kind of just more pain dependent.
Okay.
Your discomfort level You're free to do. We want you up and active. We want you getting back to your normal activities. We want you doing that exercise walk each day.
Driving,
Driving's fine as long as, you know, of course,
Right.
off the
Off the
narcotics
pain,
and
yeah.
medicine, and you feel your reaction time is back to normal. But yeah, driving is fine. So we want and all this is in the folder. We want you watching for infection at your incision. Some drainage will be normal. You're going to have sutures underneath the skin and then steri strips on top of the skin. So it's dissolvable sutures underneath the skin. So we won't have to take out any sutures unless they have to put a small one in for your chest tube. But that would be Dr. saying
Suture, that's like.
stitches.
stitches.
Oh.
Stitches. So inside they dissolve, outside it's just little steri strips, which are just a row of little bandages.
Gotcha.
Those stay on as long as they can. Some people's skin chemistry, they fall off in like 2 or 3 days because they're super sweaty or their skin is oily. Other people, they stay on until I see you at your 3-week appointment.
Okay.
Keeping them on a long time improves
Healing.
okay, but decreases scar.
No, it
Look
has
at the
nothing to do with
No,
the scar.
okay. Oh,
Nope.
something. Closer together.
Keeping them on can improve healing, but we don't,
Okay.
like, if they fall off, we don't put new ones on. Okay, we just let it
Fall
and
off.
We don't expect you to keep a bandage over it unless there is some drainage that you don't want to get on your shirt or something. Drainage those first couple weeks, clear kind of yellowish drainage is normal. Anything that looks infected, anything that just looks abnormal to you, a fever of 101.5 or greater are all reasons we would want you to call and let us know that you have some concerns. Okay? You can shower on day 2 after your surgery. We don't want you to submerge the incision, so no hot tubs,
Okay.
crazy parties in the lake. I
Spent
know.
$1 million on that party.
I know. You're gonna have to get it in before the surgery. No baths until I see you. Once your incision is healed, you know, you're fine. That's kind of it in the scheme of things. I mean, your first couple weeks especially, our goal is to keep you reasonably comfortable.
Right.
You're not going to be pain-free, okay? It's not the most comfortable surgery in the world, but it's not the worst.
Right.
So it will be, you know, we want you, because we gotta balance. We don't want to over sedate you in an attempt to get you pain-free, because then you can't get up and do the things
Right.
you need to do.
That's really the change in the philosophy. It used to be really put you down, put you out. Now
Right.
it's sooner to get you out and more active, the more the idea
Faster
of blood
healing,
flow.
you will, yeah.
Right, and
Yeah.
faster healing.
So we will be able to do pain medication for 2 to 3 months. I don't hope or anticipate that you will need it that long, but we just let you know at 2 months if you're still on